Hi, my name is Esmeralda Gold, and the gap in care that I will be discussing in my facility is patients being readmitted within 30 days of discharge for the same diagnosis. I did do an analysis chart, and this chart has the ability to pinpoint either to a supervisor or an individual or a entity on viewing their strengths and weaknesses in the organization that need attention or that must be looked at. This a SWOT analysis chart is able to help with strengths and weaknesses for the organization, and it will allow efficiency to be pinpointed in order to improve either the quality of care or whatever your initiative is going to be for the use of this chart. My quality inspector spoke to me about 3 issues that our hospital faces. One of them, the major one, was readmissions of patients within 30 days of discharge for a previous same diagnosis. Also, we had fallouts for patients that were discharged with inappropriate evidence-based medication depending on their diagnosis. We also had issues pertaining to RNs not adequately assessing patients' discharge care planning, whether they needed to go to a skilled nursing facility or require home health or medical equipment required for the patient to discharge safely. Those were the 3 main concepts that were brought up to my attention. But the main one that I will be speaking about is patients being readmitted within 30 days for the same diagnosis. This was a huge loss of revenue for the hospital, and so the hospital's trying to improve on this so that they can get paid for the services rendered. So the way that they were able to determine that quality improvement was needed was through websites. The hospital is registered with many websites, Crimson being one. So this is like a report card that a hospital gets, and it pinpoints certain issues that the hospital faces after a patient has left. It's a form of an evaluation. So the big issue was, and the way the hospital was impacted was because they were not receiving payment. Hospital's identity was being pinpointed on that. The hospital's image was affected. So basically the mission of my hospital is to provide quality of care. And again, who doesn't want to go somewhere and receive the best quality of care? I think we all do. So I did do a PDCA plan. And so this plan sort of gives you a goal. It targets your goal. It asks you what kind of improvements you're going to be implementing. My hospital decided to establish a co-management committee, and this committee entails cardiologists, RNs, case management, the quality department, and they did start a continuity care registered nurse. So this person's able to analyze, this individual would analyze within 24 hours of this patient coming back into the hospital, where we fell, where the fallout was. And therefore, obviously proper training and education would take place. So then we would be reevaluated by these individuals and see where we needed to pinpoint the improvement. So basically, the expected outcome for starting a committee and making all these interdisciplinary teams to work together in all different units to communicate better so that the patient is discharged adequately, and therefore the hospital could get their money and the patient's not going to come back. This RN is in charge of ensuring that 3 days after the patient is discharged, they receive a call and she asks them questions, adequate questions pertaining to their discharge. Are they having pain? Is it incision related? Is it medication related? If it is incision related, can we make an immediate appointment with the doctor so that the patient doesn't have to come to the hospital back, but rather see the doctor? Or is it medication related, where we can call in to the pharmacy another medication for the patient? So this issue has helped improve the readmission of these patients to decrease that. Overall, I feel that the hospital has made improvements, obviously with good communication between interdisciplinary teams, proper training and continuum of the committee meetings, ensuring that the whole units and different units are involved with flyers, information, and leadership communication with all these employees and staff members to continue the change in the hospital. So overall, the hospital wants to ensure that, it's done within a timely manner. As far as I know, my quality inspector did tell me that there was no budget allocated for this quality change, but it was being absorbed through, obviously committees, the staffing, scheduling, making sure that the staff was being developed so that this continuum of care could be processed and adhered to, and to ensure that the hospital was discharging these patients adequately. And so ultimately, I feel that the hospital has improved some. My quality inspector did state that it has been 6 months and they've seen a maybe 5 to 10% improvement in the changes that they've made, but it's a continuum of development that has to continue on. So I hope that I was very informative in the way that I presented my my explanation of the gap care in my hospital. Thank you.